our next presentation comes from Harrison County. Michelle Schreier will be presenting on the medication-assisted treatment, or the MAT clinic, that is located within Harrison County Hospital.
Hello, my name is Michelle Schear. I am a nurse practitioner at South Harrison Family Medicine and practice with Dr. Brian Albertson. Both Dr. Albertson and myself offer family medicine services to the rural communities of Corydon, Indiana, and surrounding neighborhoods. In addition to family medicine services, we have extended our treatment practice to those with opioid dependence, and now offer medication-assisted treatments in an office-based outpatient setting. As the opioid epidemic continues to be evident in our communities and in our emergency room departments, there are sparse resources available for those who seek relief from their addictions. With our location within the rural community, we have a better advantage logistically to serve those around us who would not otherwise be able to access care for opioid addiction due to transportation barriers, time and distance factors, and other means. Dr. Albertson and myself feel it is important to offer this additional service to our patients and our community, as the rise in illegal offenses leading to incarceration due to an opioid addiction, increase in ER visits for opioid overdoses, and an increase in frequency of friends and families losing their battle with opioids with their lives. Our medication-assisted treatment program strives for individuals to achieve remission from their addiction, thus reducing the number of incarcerations due to activities of crime or abuse performed by somebody under the influence of opioids, decreased emergency room visits for overdoses, keep friends and family alive so they may continue to interact with those they love, allow the individual to be present with their significant other, their children, their parents, gain sustainable employment, and additionally, decrease the volume of children in the foster care system due to the parents or the caretakers suffering from the perils of their addiction. The partnership between the primary medicine and medication-assisted treatment in an outpatient office-based setting will provide preventative care, early identified health issues, which would in turn reduce chronic comorbidities associated with disease processes of long-term uncontrolled duration, while also having a medical provider to walk alongside of them as they seek to overcome their opioid addiction. We will offer health screenings for diseases that are often associated with drug addiction, such as hepatitis, HIV, and syphilis. Treatments will be offered through our office or referrals placed with a specialist as appropriate. Our services in addiction recovery will provide medication-assisted treatment, counseling service with the medical provider in office, and or a referral for a drug addiction counseling specialist. Providing additional information in the community for employment assistance, housing assistance through local and state programs, and if needed, information will be provided for the healthcare exchange and if an individual is in need of health insurance so that medical care expense is not a barrier. South Harrison Family Medicine can offer opioid addiction treatment through the passage of the CARA Act of 2016, which expanded access to care for those suffering from opioid-use disorder, allowing medication-assisted treatment within the office-based setting. The CARA Act also increased access to medical providers by adding advanced practice nurses such as myself and physician's assistants who can offer and provide medication-assisted treatment services. Each individual seeking assistance in overcoming their opioid addiction will be prescribed naloxone in the event that they have a relapse and are ever in need of opioid reversal in the event of an overdose. Our goal here is to offer compassionate care, understanding the disease of addiction, and also communicating to each patient our desires for their success in the program. South Harrison Family Medicine is part of Harrison County Hospital Healthcare Organization. We are an acute care community hospital serving the healthcare needs of the growing population of Harrison and Crawford counties in Indiana and Meade County, Kentucky. Our service area is approximately 60,000 residents. Harrison County Hospital is uniquely affiliated with Norton Healthcare, which gives patients access to all resources of the largest healthcare system in Louisville without leaving the rural community. Harrison County Hospital is accredited healthcare organization by HFAP. Interested individuals suffering from opioid addiction can begin their journey to wellness by contacting us at 812-734-3899. Referrals can be faxed to 812-734-3897. We look forward to walking this journey with you.
Wonderful. Well, thank you for that presentation of a program there in the MAT clinic. I know we've had some questions for Doug still coming in during that video, and I appreciate that. So quick reminder, if you have any questions, you can go to that InROC help link, and we are addressing those. I know Amna and I are already been researching a few questions. We'll be getting back to people most likely tomorrow on some questions, if not middle of the week, as some of them are requiring a little bit more work. To find the correct answer for you, make sure we have a complete answer. In addition, we want to remind you that if you do need to leave today, we do ask that you complete our post survey. This just helps us for evaluation purposes, as this is a federally funded grant. So after that presentation, please, if you have any questions, add those to the chat so we can ask them now. But I know Dr. Anwar, you had a couple questions as well.
Do we have Michelle with us?
Yes.
Hi, Michelle. How are you?
Good.
Thank you so much for your presentation. I know when I talked last with Allison and you had not started seeing patients at your clinic. Have you guys started that? And how many patients have you seen so far?
We have not had. I had 2 that was initially scheduled, and they were both in continued care. So they were looking to transition over here for closeness because they have to travel to Louisville to seek their treatments, and the timeline didn't work for them with their refills and the office availability. So we're looking to start with them again in the next probably about 2 weeks to get them on board with us. So I'm very excited to have at least the handful of patients that I know are on the medical assisted treatment, desiring to come to our office, both because they're familiar with our office and know the care that we give, and the distance issue.
The distance issue is a huge issue in any rural community. So having these clinics within a close distance of your residence usually helps maintain that continuity with your treatment. So that would be really good.
Yes.
But I wanted to ask you, like with COVID, seeing patients in person has also resulted in some barriers. So have you guys adapted or thinking of adapting towards moving some of your services towards telehealth?
We did. We did a lot of primary care initially, or follow-ups, or just general acute visits, telehealth. And then I was the one that had asked the question if the nurse practitioners could do the video with the medical assisted treatment. It seems Harrison County organization had said that the insurances no longer would allow for us to provide telehealth services. I'm not sure if it's a mixture because we're nurse practitioners as well as doctors. All of our primary care offices have nurse practitioners within the office settings. So I'm not sure if it was just a broad sweep, but we have halted the ability to do primary care with the telehealth. So I know that the medication assisted treatment programs have the ability to continue virtually. I was just not sure if the nurse practitioners, myself, I know my partner, Dr. Albertson, would be able to do it, telehealth, for the medical assisted treatment. But just for the reasons that were brought up with one of the other speakers, I think with Alex, April, I think she brought up, the COVID, the patients can't come in because of they were sick and they didn't know if it was COVID or not. and they're going to miss their appointment. And that's a very big challenge that April brought to the forefront of my mind, because we have to be able to make contact with that patient, or the patient might lose their treatment for a period of time until they're able to come into the office. So that is something that I'm going to need to investigate.
Yeah, and we have your question, and obviously Doug will be researching, but at the same time at Indiana, we also, at Indiana Rural Health Association, we also house the Upper Midwest Telehealth Resource Center. So anything and everything that you want to know about telehealth, I have reached out to the project director, Becky Sanders, and once I get a confirmatory answer, I have an answer, but I want to confirm with her. I think then we will reach out to you to get you that answer, and to everyone who is also attending, just to get that answer to you. As far as like MAT, there have been a lot of DEA modifications when it comes to prescribing medication-assisted treatment via telehealth, especially in COVID. Even the initiation of MAT is now possible via telehealth. But like when it comes to whether it's a nurse practitioner, since you are also prescribers, so and it is a physician, just need some confirmation on that. So we will definitely get that to you.
Okay, that'd be
Hopefully
great.
very soon.
Thank you.
Do we have any questions from the audience for Michelle?
None have come into the chat, but please feel free to unmute your line if you have a question to ask Michelle directly.
I have another question, Michelle, for your clinic. Are you only receiving referrals, or the patients can actually connect to your clinic directly?
Either one.
Okay.
Either one.
So if any patient has any kind of diagnosis, or even if they feel like they need to connect, they can just come in and you can also screen them if they
Yeah.
actually are suffering? Okay. What
Yes.
kind of screening tools are you guys using?
We have ongoing, in the past, we have always had a screening question regarding substance abuse, alcohol, in the new patient package. And so that has always been, it's probably not a very effective screening tool for that. It's just kind of a yes or a no type of thing. And then if, of course, yes, then we inquire further and hope for their honesty. That's all we can hope for. So going forward with the medication-assisted treatment, they're scheduling that for those visits. So just they're already acknowledging having an addiction issue.
Thank you so much, Michelle. And if anyone has any more questions, you can still reach out to us, as Dr. Mullen has been mentioning, using that secure link, and we will get your questions to Michelle. Thank you so much, Michelle.
Yeah, you're welcome.
Thank you.